When you experience a bone break, also known as a fracture, it's important that the bone can heal properly in its original position. The orthopedic surgery is an effective procedure that requires careful preparation if your goal is to experience a safe and successful outcome. Making the correct preparation before orthopedic surgery can lead to faster healing and recovery and the best possible outcome. So, what are the preparations before surgery? Thorough history and physical examination is done before surgery. A comprehensive history intake includes the patient's medical history, past medical history, family medical history is crucial before surgery because many chronic conditions have the potential to affect the outcome of your surgery. Chronic conditions that are not well managed may lead to problems. So work with your doctor to get chronic conditions under control before your surgery. For example, uncontrolled diabetes can cause your wounds to heal slowly. Second is routine blood works and imaging. Blood tests are frequently drawn before surgery. This is done for a number of reasons: to examine your general state of health, to determine if any signs of infection are present, or to determine how a specific organ is functioning. There are specific tests that your healthcare provider orders depends on your multiple factors, but some common ones includes the complete blood count, the blood chemistry panel, liver function panel, PTT or INR for coagulation study, arterial blood gas, pregnancy test if you are female, and ABORH type and screen and ABORH type and cross match. The third is refraining from blood thinners like aspirins or medications like NSAIDs. Anticoagulants thin the blood and increase the risk of bleeding. Surgery and procedures also have a bleeding risk, and so anticoagulation may need to be stopped for a short period to ensure they can be carried out safely. And also for the medication, unless otherwise instructed by your doctor, you should stop any medications containing aspirin or anti-inflammatory drugs such as ibuprofen or antihistamine 7 days before your surgery, because some medications may increase bleeding or interfere with your body's natural healing process, and some of them may even interfere with the anesthesia you receive before surgery. The fourth one is informing about allergies. It is very important that you tell the nurse and anesthetist looking after you if you have any allergy on medications, anesthetic agents, and latex. These allergies significantly affect patient morbidity and are associated with a risk of death during surgery. So it is very important that you will work with a doctor and inform all the allergies that you have. It is very crucial to keep in PO for 8 hours before surgery. Ordering in PO after midnight has been a common practice to lower the risk of aspiration of gastric contents during general anesthesia, which is due to a part of suppression of laryngeal reflexes from anesthesia. And the most important is informed consent. It is an essential step in helping patients be aware of the consequences of their treatment decisions. With surgery, it is vitally important for patients to understand the risks and benefits of the procedure and decide accordingly. Bone fracture repair procedures. When you experience a bone break, also known as a fracture, it's important that the bone can heal properly in its original position. There are several treatments for a broken bone, and the one a doctor recommends is based upon several factors. These include how severe the break is and where it is. While some bones can heal by wearing a cast, others may require more invasive treatments such as bone fracture repair or surgery. So first is non-surgical method, casting and splinting. Cast and splint supports and protect injured bones and soft tissue. When you break a bone, your doctor will put the pieces back together in the right position. Cast and splints hold the bone in place while they heal. They also reduce pain, swelling, and muscle spasm and ensure it remains in proper alignment. And the application of a cast is 4 to 6 weeks. The other option is closed reduction. Closed reduction of the fracture is indicated for displaced fracture in which there is radiographic evidence that a stable realignment of the fracture fragments can be achieved and that the minimal residual interfragmentary motion can be controlled with meticulous casting technique. Next is bone fracture repair surgical method. One common term for operative fracture stabilization is called open reduction internal fixation or ORIF. This means that a formal incision is used to open, the bones are realigned reduction, and an implant is used internal fixation to maintain that alignment so the body can naturally heal the fracture. An open reduction internal fixation is a surgical procedure for repairing fractured bones using either plates, screws, intramedullary IM rod to establish the bone. It is used to repair severely displaced or open bone fractures where the has pierced the skin. We have two kinds of fractures here. The compound fracture is comminuted fracture or open fracture, which is the bone has pierced the skin. We have here external fixation. External fixation is during the procedure, the surgeon will insert metal pins or wires into the bone above or below the injury site. The pins are attached to a metal bar outside of the body. The external fixator frame will keep the injured bone stable and aligned, and it will allow or correct position while they heal. The next one is intramedullary nailing. A small incision is made and a titanium rod is inserted into the canal of the bone either at the hip or the knee, and it is screwed to the bone with titanium screws at both ends. The intramedullary rods helps to keep the bone in proper position during healing. The last one is plating and screws. This is for complex fractures or comminuted fractures. A plate may be applied to the bone. During surgery, the bone fragments are aligned and then a plate is secured to the bone with screws. The plate keeps the bone fragments in the correct position while the bone heals. Eventually, when the bone is fully healed, the plate can be removed. During post-operative process, your surgeon will likely prescribe a combination of treatments. This may help pain control and lessen side effects. A combination of treatments also can help you resume activity appropriately for recovery and lower the risk associated with opioids and antibiotics to prevent infections. And physiotherapy plays a big role in the healing process of the bone. This is important as an attempt to prevent post fracture stiffness and weakness in the adjacent joints and muscles during the first 6 weeks while your fracture is healing. After 6 weeks or later, your physiotherapist will work on regaining full joint range of motion and muscle strength. And also, refraining from strenuous and heavy lifting activities is very important. The bone repair can be sensitive and need recovery time. It is best to avoid activities with a high impact on the bones or in the legs, such as football or any form of sports. Avoid activities such as jumping, long jump, or etc. Avoid activities like riding a bike or cycling or driving a car. Incision site care instruction is given after discharge. It is important to keep the wound clean and sterilized by changing the bandages as recommended and following protocols put in place by your doctors. An incision infection can cause significant challenges and, in some cases, pose a severe threat to your health. And it is very important to remember that complete healing of the fractures may take several weeks to several months. Bone fracture repair post operative complications. Delayed complications may occur after treatment or as a result of initial treatment of bone repair and may include malunion, embolic complications or pulmonary embolism due to blood clots, osteomyelitis or infection, loss of function, persistent pain, hardware failure, or hardware migration, and damage to surrounding soft tissue. The good attitudes and proper treatment regimen compliance post-op is very crucial to prevent complications, and antibiotic therapy must be appropriate and adequate for prevention and treatment of infection.